Happy Saturday. I have a very exciting live show today. I have an interview with Dr. Lindsey Pennington, which is a plastic surgery specialist for facial plastic surgery and neck plastic surgery, but we're also having this amazing giveaway. So I'm gonna let you guys start coming on. Hello, hi, for craft's sake. I'm gonna invite Dr. Pennington on right now. Let's see. But I want to tell you guys a little bit about the giveaway. Just a sec. Okay, I'm going to tell you guys about the giveaway real quick. So for all of those of you joining, let me see if I can ask her one more time. Sometimes we get a little bit of a delay here. Let's see. We just did a practice, so I know that we got this down. Let me tell you a little bit about this giveaway while Dr. Pennington is coming on. Every Saturday from now through, I believe, Christmas, I'm going to be doing a giveaway. This is by Magellan. This is a red light therapy mask along with the neck and décolletage attachment. So this is what is for the giveaway today. You're not going to be commenting red light right now, but when I post this to my main feed is when you're going to be commenting red light. You're going to be tagging a friend and you're going to be following Magellan Official, and all of that will be in the, let me see if we just got her on. Oh, maybe not. Hey, for craft's sake, we're having a little bit of a problem here. I'm going to try one more time to get her on. Well, I'm going to try many times to get her on because we were just having a little bit of a chat. I'm going to invite her again. Invite. Okay. But if you guys can all still hear me, this is by Magellan. This is the LED red light therapy mask, the face and neck décolletage. Oh, we just got joined. Okay, yay. Hi. Hello, Dr. Pennington. How are you?
Good. As I have lost my voice, so I'm over here drinking tea, hoping that our chat goes well.
Well, I want you just to rest up for 1 second because you guys, this is one of the most exciting Instagram lives that I have been geared up to do because I have talked to many male plastic surgeons. I have yet to talk to a woman plastic surgeon, and to top that off, you are like top of the line badass. Like I don't know how else to say it. Like
well,
really, but
you.
Just hold on for 1 second because I'm telling everybody here how to join the giveaway, because after we post this, we've got so many questions that have come in, but I want your followers to be able to win this set as well. So when I post this to my main feed, you guys, I'm going to invite Dr. Pennington on for a collaborator, so she'll be able to hit all of those hardball questions with the deep plane facelift and the neck lift that we're going to be talking about. But to get into the giveaway, what you need to do is once I post this to my feed, and it will also be on Dr. Pennington's feed, you're going to comment red light. Just in the comment section, comment red light. Then you're going to follow Magellan Official, and you're going to tag a friend who loves skincare. This mask and neck décolletage set is $269, and it's going to be given away to one lucky winner, and the winner will be announced next Saturday on Instagram Live. So I'm going to take this off for now. This is what's up for grabs, okay? And I've done a lot of live shows before and a lot of content on the benefit of red light for healing, on the benefit of red light for wrinkle reduction and pigment and all of that. So this is what's up for grabs, but I will have that in the comment section. I will tag it so you guys have all of those exact instructions on how to get into the giveaway. Okay, welcome, Dr. Pennington.
Thank you.
I'm going to tell a little bit about you because your bio is super impressive. And when we just had a little chat, I said, you know what? I'm not going to have you strain your voice and do your bio because we've got some questions for you. So Dr. Lindsey Pennington is a double board certified facial plastic surgeon. She was the first female board certified facial plastic surgeon with a solo private practice focused on cosmetic rejuvenation in the state of Louisiana. You guys, do not be afraid to travel for good work. Do not be afraid to travel for good work. Okay, let me go on. She graduated with research honors from medical school. Then she went on to do a 5-year surgical residency in head and neck surgery, and then was accepted into and completed an additional fellowship year. I mean, your wall, look behind you.
Yes, exactly. exactly. If we look at all the diplomas, I spent a lot of time in school.
Diplomas. So you're located where? You're in Shreveport, Louisiana?
Shreveport, Louisiana. It's North Louisiana, so it's about 2.5 hours south of like south, actually, just like east of Dallas.
Okay.
So we're really
But
close to Dallas.
here's the good thing. You pride yourself on attention to detail, and the results are driven back by research. She has a state-of-the-art, fully accredited surgical center. I told you it was very laid back, right?
Perfect. Yep. It matches my voice today.
You have your own surgical center with a full team that focuses on the recovery process to include implementing pre-operative optimizations of proprietary IV infusions, oral supplements, curated meal prep with low salt, low inflammatory nutrition, and hyperbaric oxygen in post-op period to rejuvenate and expedite the healing process. You are covering it, all of the bases.
That's the goal, because it all matters. You know, what you do before surgery, what you do during surgery, and what you do after surgery all play together. I can do an amazing facelift, but if afterwards the patient isn't caring for themselves properly, they're not going to be able to retain that investment. They're going to lose their skin quality. They're going to have a long time healing. It's going to completely ruin the process for them. So it's kind of like a marriage. Like, we're in this together for the long haul. Not only do I want you to have amazing results on the table, but I want you to maintain these results for the next 5, 10, 15 years.
Yeah. And I don't even know if you know this, but I did have a neck lift and a lower facelift about, I want to say I was 49. So yeah, 7 years ago. And so I have my results in terms of my before and after. Now, I was young. I was just before I turned 50, like literally 3 months before
That's a perfect age, in my opinion. So it's a lot of times it's a more progressive thought process to be doing these procedures like younger and younger. I think it's anatomy based, particularly with all the weight loss that's happening now. I'm seeing younger and younger patients with more laxity than you traditionally would have seen. But when you are doing a surgical repair on somebody whose skin quality is still good, who still has some collagen and elastin, your results are going to last longer because what I'm working with is a little bit better. So I think as long as there's enough laxity and signs of aging to do an intervention and that you're going to get a result, I don't think you should be doing preventative surgery, but doing it at a time where you don't have to wait and spend 10 years disliking how you look and then having this dramatic wow before and after. You can, aim for maintaining.
Exactly. It's so funny that you say that, because mine was, I was one of those pre-thinkers, right? Keep drinking your tea. You're not going to disturb anybody. I have my mushroom coffee here.
Yeah, perfect.
But I was one of those pre-thinkers because I always thought, I had heard from somebody from one of my many doctor friends, I've got them on speed dial at this point. But I heard from one of my many doctor friends that you heal differently before 50 than you do after 50. There is some bizarre cutoff on your healing process. And so I always knew I was going to have at least my neck done prior to 50. And I wouldn't call it preventative, but that is a big difference in my profile.
Absolutely.
That has maintained for all of this time. And so I think that there are a lot of people that are going under the knife earlier and thinking, I'll have this one, while the facial anatomy, I'm noticing it, right? And I still feel like there's a lot of people that, they still feel like at 50, I'm still in the game. They're on their second marriage, right? Which was me.
Yep.
I don't want to look back on my photos, of my second marriage, my best marriage, and think like, well, why didn't I get this done right before? And so I did 3 months before, which brings me to question number 1. I had a lot of questions pouring in. How long does it take to recover from a surgery that's like this? Now let's talk deep plane facelift.
Yep.
And how does that differ? It's going to be a multi-part question. Okay. How does that differ from the facelifts that they used to do? And what is the recovery process, assuming that everybody follows what the doctor orders?
Yeah, so that's also multi-part. So when we're talking about the recovery process, and you had mentioned the age 50. So I kind of say in my practice 55. So like my 55 and younger, I say it's a 2 to 3 week period of recovery When we kind of get over 55, I say it's closer to 3 weeks. And then when we're over 65, I say it's 3 to 4 weeks before we're like really feeling ourselves back at it. And so with the deep clean facelift, the techniques have come so far that we're doing things like preservation facelift, where we're doing minimal lamination, where essentially we're not raising skin. Traditional, kind of the more old-fashioned types would elevate skin all the way out. And then not only are you healing from swelling and tissue trauma, but the skin itself has lost blood supply, the lymphatics are disrupted. And so with preservation facelifts, with really well done extended deep plane facelifts, it's actually less traumatic to the tissue, so the downtime is less. So traditionally, I tell my patients it's a 2-week period of time where I want you doing nothing. I want you being a slug. I want you hanging out, listening to audiobooks, eating healthy, sleeping good. And it's not something where I want you sleeping all day, sleeping all night. Like, it's just being cautious. And it's not because you don't feel good. My patients, we do the entire recovery process with zero narcotics. And so it's something where on the day of surgery, the day that
hold on, wait a second. You do the entire recovery process with zero narcotics,
including the anesthesia. Like, you don't even get IV narcotics during the anesthesia process. You get a little bit of IV Tylenol before you wake up, which is like acetaminophen. It's something where it doesn't make you loopy, it doesn't make you constipated, it doesn't make you nauseous. And so I find that the least amount of medicines my patients get, the faster their recovery is too. They're not foggy, they're not feeling slow, they're not feeling tired. And so it's something where being very proactive in the process can make a very big difference. And then even on the day of surgery, we do, like, while they're asleep and I'm operating, they're getting an IV infusion of vitamins and peptides so that it's like a marathon. It's something where your body is kind of going through a trauma. It's a marathon and you need to provide nutrients, and that's what your body uses to heal itself. And so instead of just getting saline throughout the surgery, the patients are actually getting stuff that's going to help them repair and recover. It's going to kind of knock out some of the free radicals that you get by being exposed to some of the anesthesia medications. And then we do that again on post-op day 1 and have them get into a hyperbaric chamber. So it's something that we're doing a lot of things that together cuts down on downtime, in addition to just meticulous, careful, gentle surgical techniques.
Yeah.
So 2 weeks is kind of I want you hanging out, but I call it like grocery store ready at 2 weeks. You can go out in public. Nobody's going to know that you've had surgery, but people who know you really well are going to be like, you look a little puffy. Did you eat a bunch of salt last night? Did you have a martini? Those kind of things.
I had a 3, just to let your voice rest for a second.
Yeah.
I had to go home 3 weeks post surgery.
Mm-hmm.
My family, who you think would know me, my face, more than anybody in the world, did not know I had anything done.
Absolutely.
At 3 weeks. At 3 weeks. And that's, that's not a giant difference because, again, I was 49.
Mm-hmm.
I was not 49.
Yep.
I was 50. I was like a couple weeks before I was 50. So it's not a giant difference. You get the giant differences when you're looking at somebody, you can see it here in the neck. But when you're looking at somebody, you're doing a facelift on somebody who's 65.
Yep.
Who doesn't look like they did when they were, there's not a lot of remnants of when they were like 25 or 30. And then you're taking all those years off and you're going to get that wow factor.
Absolutely.
You're saying that is, and not that that's bad.
No.
The wow factor is great for those that want to wait. But for me, it was more like I wanted a very, very subtle difference. And so with the shortened recovery time of 2
Mm-hmm.
weeks, and you're saying you're pre-55-year-olds who are getting this
Yes.
done, and no narcotics, which, by the way, is mind-blowing to me.
Mm-hmm.
But I can see how that would reduce recovery time. Is that because of the you're doing it in such a way that you're not peeling the skin back anymore?
Absolutely. And so that's part of it, is there's just general less tissue trauma. So you're going to have less swelling, you're going to have less bruising. And when you have less swelling and bruising, there's less to recover from. And then that's where that being very compliant in the post-op period is very important as well. Because if you go home and eat mac and cheese and you puff up, it's going to take your body weeks to depuff and de-swell. But if you never get really swollen in the first place because you're eating low salt, you're eating low inflammatory, you're staying elevated, you're following the, your doctors, whatever their protocols, instructions are, you have less to recover from because you're not going through as much of a roller coaster. And so my version of bruised and swollen is very different than other versions of bruised and swollen that I've seen.
Yeah.
And so it's just one of those things that it depends on what's kind of important to you. I always remind my patient it's short-term losses for long-term gains. So you're going to spend a couple weeks eating kind of bland food, but so that you can spend the next 10 years really enjoying these results and not being self-conscious about pictures or videos or life. It's one of those things that patients who come to have a facelift are not these kind of just like sitting at home with nothing to do people. They're active, they're living their life. They feel great and they want their faces and necks to match how they feel. And so it's the hardest part, honestly, is getting somebody to sit still for 2 weeks. That is my kind of thing that I have to overcome.
Yeah, I would agree. Like anything when I've done even my breasts, to not exercise and to like really listen to what the doctor is saying is so important. Not only the stuff after, but the stuff prior.
Absolutely.
And one of the things that they're saying now, which honestly shocked me, is that even matcha green tea will thin the blood.
Yep.
And so can you go over some of, we know the typical stuff like no Advil, right?
Yep.
And you stay off of fish oils. You don't want stuff that's going to thin your blood. But what are some of the newer things that you guys have come up with now that is going to make the surgery itself less traumatic, which is going to make recovery less traumatic? What should we be doing before? And then we'll get into what we should not be doing in office procedures before.
Absolutely.
So what should we be doing before to give us the best results?
So ahead of time, like in general, whenever a patient books surgery with me, I give them recommendations from a skincare routine. So making sure that we're using vitamin C's, that we're using antioxidants, you have a good sunscreen, doing things like microneedling, things that are going to improve the collagen and elastin in your skin so that when I'm in there, I'm dealing with better tissue qualities. It's going to set you up for success. That's huge. Then when we get to like the 2-week window before surgery, I have a checklist of what to do 2 weeks before, 7 days before, 4 days before, the night before. And it's stopping things like fish oils, like aspirin, like ibuprofen. But vitamin E is something that a lot of patients don't know about. A lot of my patients are on Nutrafol. I have you hold that for 2 weeks before. And then, like you said, ginkgo is something that, a lot of people use for brain health. That's not a good one. And then ginsengs, green teas, and then I even have you hold caffeine for a couple of days prior. So it's a whole list of things that you can go through.
Yeah.
And then I have supplements that I provide my patients that they can start taking 2 weeks before surgery so they're not missing out on the nutrients, but they've been carefully curated to make sure that they're ones that are not going to affect kind of the bleeding part of surgery. Because if you have a lot of bleeding during surgery, one, it slows the operative process down, and two, it increases the amount of bruising that you have as well. So anything that we can do to have you kind of not have issues bleeding makes my job easier, makes your results better as well.
I love that. Before we get into the in-office stuff that we shouldn't do, for those of you who don't know me, because I know that there are a lot of people who are on here who are Dr. Pennington's clients, or it's going to be posted on your feed as well. Let me just introduce myself a little bit before I tell you about my whole skincare protocol thing, because you just reminded me of something. My name is Darnell Cox. For those of you who don't know me, I am 56 years old. I'm a gerontologist, so I actually went to school to study the aging process. I'm also a holistic nutrition and health coach. I'm a 500-hour yoga instructor. There's a lot of stuff that goes on, but basically what I do in the short term is, in the shorthand of it is I help people live longer and look better while doing it. And I look at the organ, I look at skin as the organ that it is, because it is our largest organ. It is our only outward facing organ, and it is that organ which is tied to our self-esteem. We don't walk into a party and say, have you seen how dense my bones are? Have you seen how clear my arteries are, how healthy my heart is? And all of this is aging. But when we walk into a party, or we walk into a meeting, or we're on that Zoom, we are skin first, we are face first, right? And so There's a lot of self-esteem in the aging process that has to do with this one amazing organ that keeps all the other organs inside. And so when you talked about getting your skin prepped for the health, so for those of you who don't know me, that's who I am. But when you talked about getting your skin prepped and the health of the skin, I devised this whole calendar. It's a monthly calendar, but it shows how I incorporate things like microneedling, like microcurrent, like radio frequency, like red light therapy, those kind of things that kind of help with the collagen boosting to get that collagen and that elastin and thicken that skin back up. So for those of you who don't know me, when this does get posted to my feed and to Dr. Pennington's feed, if you just comment the word protocol, it will automatically go to your DM. Or you can go to Live Young Lifestyle. All the free protocols are there on younger looking eyes, on how to microneedle at home, on a lot of different stuff that I do, how to choose a retinoid that's right for your skin. These are all on my website. So I want to get back now to what are some of the in-office stuff that people should not be doing if you know that you're going to have a facelift. Mm-hmm. What should you not be doing in office?
There's a lot of things that have gotten a lot of like bad raps on social media. So everybody should be doing Botox and skincare pretty much their entire lives, before surgery, during surgery, after surgery. I do have my patients hold off any Botox for 3 to 4 months before surgery, just so I can see where stuff naturally sits or lays. As early as 2 weeks after surgery, we can jump back on that Botox. We can jump back on our routine skincare. We do have you hold any retinols 2 weeks before surgery, and we have you wait 2 weeks after surgery. Microneedling is a good one to do. Things that I don't want you doing right before surgery would be getting some HA filler, getting some Sculptra. Those are ones that they have a beautiful place within kind of the anti-aging process, but it's something that it's just kind of a waste of money to do it right before surgery, because I'm going to be doing things like putting your fat pads back where they belong, doing some fat grafting. So things that you've been doing for volume aren't necessary right before surgery. So I like to say, hold off on doing any fillers or Sculptra the year that you're planning to have surgery. So ideally not a year within surgery.
So are you, Dr. Pennington, are you one of the surgeons that use the hyaluronidase and actually get rid of the filler prior to surgery so that you have more laxity in the skin?
Don't. So there's 2 areas where I do reversal. So I dissolve or use Hylenex or hyaluronidase if there's a lot of filler above the lip, or if there's any in the tear trough, because those are areas where it can really distort the anatomy when I'm doing a lip lift or a lower eyelid blepharoplasty. So those are 2 areas where, as ideally around 6 weeks before surgery, we're doing a round of reversal, because sometimes it can take more than 1 round of reversal to kind of get to that patient's baseline anatomy. And I find that patients can say, look, it's been 10, 15 years since I've had any filler. And I can tell by looking at them, I say, I guarantee you that if I put some Hylenex in there, it's going to dissolve. And they're like, okay, well, we can try. And then I do it and they come back and they're like, oh my God, you were so right. I swear it's been so long. And so certain areas that are less metabolic, like your tear trough, can really hold on to filler. Yeah. So those are the spaces where I do reverse. If it's kind of mid face, lateral face, those kind of things, I don't do any reversal unless I find that it's significantly like via festoons and it's holding fluid or things like that. I'll do some reversal prior to surgery, but I don't go and dissolve your whole face before surgery. It's something where knowing what you've had when you've had it helps me kind of make decisions about how much fat grafting I'm going to be doing versus lifting. And it's funny, like I'll be operating and I can see the filler in there and I just kind of scrape it out, squish on, move on. That's one of those things. I don't think it's worth going through the whole process. And the way that Hylenex works is it doesn't kind of only work on the HA that is filler. It can actually dissolve some of your own natural hyaluronic acid. So I like to save it for when we really need it. It's not something that you just willy-nilly just put in there and do. Your body will regenerate its own, but you can end up kind of extra depleted on HA if you go in there and use a bunch of hyaluronidase before surgery.
Oh, interesting. I did not know that. I've never heard of that before. But I have I do know of a surgeon that like he is so against filler that he will, like, even if it was 10 years ago, he'll still go in there and use hyaluronidase and get rid of all of that filler so that he's got the laxity in there. But a lot of women don't like to do that because they might not have had filler for 10 years. And even though it's still there, it still feels like it's part of them. And it's kind of,
even like particularly with lips, I find that it's an area where you have some migration or you just had it where it was placed above the lips for those perioral lines and wrinkles.
Yeah.
Patients hate how it looks when you dissolve it. So doing it as close to surgery as possible before we get into that lip lift and get it back to where it's looking good. But a lot of times at that point, it already looks very disproportionate and unnatural.
Yeah.
And I think patients have lost sight of that. And so being like, oh, wow, this is what my lip actually looks like can be helpful for them to have a baseline as
That's
well.
so interesting that you say that, because I feel like that there, you know, when with people that do filler a lot or they've done it for years, there is that losing sight
Perception
of what,
drift.
yeah, of what
Yeah.
what your anatomy is originally supposed to look like.
Mm-hmm.
And because it's like incremental, I'll do a little bit here and a little bit there, and next year I'll do, and just kind of adds up that people are looking very distorted. And so,
And that's where having a provider, and that's why it's so nice with me, because not only am I a surgeon, but I still do injecting because I just love it. I like the instant gratifications. I like the relationships that I form with my patients, but having an injector that will say no, and somebody that you trust. And so I have those conversations of, I know it's been a year, you think it's time to do your lips again, but you still look good. And then them just say, okay, I trust you, and move on. And like, we'll talk about it in 3 months, we'll talk about it in 6 months. And so making sure that the person that you are trusting to inject you isn't there just trying to collect a paycheck, but is really kind of about the aesthetic outcomes and making sure that you're on the same page. And one of the things that's really great to do is just look at pictures of yourself when you were younger and kind of compare and know that that's kind of the general direction you should be going for versus something completely
it's
different.
interesting you say that, off topic, but I often say that when I talk about eyebrows, like when microblading was so popular.
Mhm.
And I often tell people, like, if you're looking for the shape of your eyebrow, like look at your eyebrows when you were like 12 or 10. You know, they're probably not the McDonald
Correct.
arches that are going on right now, right? We tend to, like, we lose
Yes.
sight of it and we just over tweeze, and we do the same, people do the same thing with
Mhm.
filler. Okay, in addition to filler, I saw something that you did on Instagram about threading.
Yes.
Let,
So
let's talk
threading,
about that, Coretta.
threading is something that I don't recommend pretty much at all, ever in general. I do offer it at my office. I never like sell it to a patient. I don't advertise it, but I want there to be a safe place for somebody to come get threading if they're like dead set on it, because I know that I can do it in a sterile environment. I can put it in the appropriate tissue planes. I can do it in a way where it is the safest procedure possible.
Right.
But in general, most of the time, people doing threads are not surgeons. They don't understand the tissue planes. And when I'm in the operating room, I find that there are threads, and I recently posted a video on this, where the thread was going all the way from superficial deep down towards the periosteum of bone through the deep plane.
Yeah.
It's supposed to be something that's supposed to stay above this mass. And so it can cause significant scarring. It's expensive. It can make surgery a little bit more challenging. And so it's one of those things that I think the risk benefit ratio just isn't appropriate. And the amount of correction that you get for how long it lasts, for how expensive it is, or how expensive it should be if you're having the right person doing it using the right products, doesn't play into it. So it's something where if you think that you need a lift, if you think you need threads, you should just be having a conversation with a surgeon.
That's, and that brings me to the next subject, because if I were to add up, like, some of my clients that I have, I do
Yes.
one-on-one clients as well, you guys. So we do, I have clients and we talk about everything from how do you live longer, how do you expand your health span, but also how do you have the best skin of your life. And if you are interested in plastic surgery, let me find a great plastic surgeon for you, and let me see, so there's a lot of that I do with private one-on-one clients. But there was I totally just lost my train of thought. I need a little bit more mushroom coffee. But there was a client that I was talking to the other day that she did this. I don't even know. I don't even know if I should say this on. I'm going to say it because I'm not going to say who it is. There are some things going on out there in terms of the world of plastic surgery that I feel are like, that is not the time or place to be the guinea pig of something.
Yeah.
And I have a client that recently, and she loves her work and she has great work and it all looks great. And I always think, like, how many ways could that have gone wrong? But they literally cut out she has incisions down this way where they cut out a little bit of this puffiness here for the nasolabial fold. And I've never seen that, an exterior scar. I've never seen that before in my life. And I just thought, like, when we're looking for a plastic surgeon, now we can look at all the diplomas behind you, but like, but what are like the basics of like, this is what you need. This is not the time. We have from Heather_Huntley, Dr. Pennington is literally the best, so talented. And I'll go back, I'm going to scroll back up and get some questions. But what are like the basics of like, what should people be looking for? Okay.
Basics are literally a board certification in either, American Society of Plastic Surgery or facial plastic and reconstructive surgery. So making sure that they're not just saying they're a cosmetic surgeon, but they're actually board certified by the two recognized boards, either, ASPS or the American Board of Facial Plastic and Reconstructive Surgery. You can go to their websites and look the doctors up. And so making sure that you have a board certified actual plastic surgeon. And then in addition to that, making sure that you have looked at their before and after pictures. Right. And that's something where ideally, even I have some of my patients are really, really lovely and kind. And if I have a patient that's particularly nervous or is unsure about a procedure, like I'll put my patients in touch with prospective patients and they'll have a phone call. I had one patient who was flying in from Chicago and she saw somebody that had tagged me in a post about her surgery and they had reached out and messaged back and forth, like talk to somebody who's had surgery with that surgeon. And that can be really helpful as well, because that's one of those things. It's like trust but verify. I do the same thing when I'm finding a nanny. Like I'll look at the references, I'll call a few, but then I'm also still going to do my own background check. Because you can't always.
And I feel like women are sometimes, they're afraid to insult the plastic surgeon by asking to speak with clients, by asking to like, where are you certified? Let me, by doing some digging, there are women, I think women oftentimes especially with male plastic surgeons, there's this fear that they're going to insult them for some reason.
If your surgeon gets insulted by being questioned, that to me is like a red flag. They should say, oh, I hear your question. Here's my answer for that. Like if you're making a decision to trust somebody, and this is like an implicit, huge trust. And that the value that's being put into, like, it's not lost on me. It's something where to trust somebody with your face, to trust somebody like financially, it's a big decision.
What is the cost?
So much
you just backed up right into that question.
But to have that level of trust, you need to be able to have open, transparent conversations. And if your surgeon shuts down, if your surgeon gaslights you, if your surgeon's not listening, that surgeon isn't a good fit for you. And that's okay. And I tell my patients, if they're telling me like, oh, I'm going to get a second opinion, go for it. The more people you talk to, the better. The more information you have, the better. And so that's something we're just being very transparent and is so important. If you're not vibing well with a doctor, it's not going to be good for anybody. So it's kind of like dating, like go on a couple dates, find out who you like, make sure that you're doing well together before you go on to the next stage.
100%. You need to be transparent as the client. You need to be transparent in terms of what are you expecting,
absolutely,
what your expectations are, and what have you been doing? So have you been doing fillers? Have you had threads before? Don't let the doctor open up your face and all of a sudden it's like Jack in the Box comes out and it's like it's a surprise when you're on the surgery table.
That happens more often than not. And patients will be like, I've never done anything. And you get in there and I find threads, I find filler, I find scar tissue in places. And so you can tell the surgeon whatever, but when you get in the operating room, like I'm going to find it. There's no hiding it. So it's better for everybody to be transparent in this process because it's just going to lead to better results and better communication in the long run.
Absolutely. So first, have you ever seen this done before?
I have not. It doesn't mean that it's not a thing. Okay. There are a lot of ways to access this area without a direct excision. One, with a really good deep plane, when you vertically get a good lift here and release this ligament, that's what's going to improve the jowl. There's micro liposuction that you could do there. There's a lot of things. So that personally isn't something that I've seen of or heard of.
It shocked me the exterior incision as opposed to not even inside the mouth. So
I have lots of questions. I would need pictures. I would need copy of the operative report. None of that.
I have lots of questions too, and I've seen her because she is a client. I have seen her,
Mhm.
and it. I think he did a good job, and I think she's going to have good work. But I just like that is, you know, right before you go into surgery might not be the time to be like, hey, what do you think about me doing this?
Oh,
If we,
so a lot of my patients, probably over 60% of my patients travel in from outside of the state of Louisiana. And it's a requirement that I see them in office the day before surgery minimum. Like we've done Zoom consultations, we've done multiple, like we've had phone conversations, we've had Zoom, they've had a pre-op consult. But I meet every single patient in person the day before surgery. I refuse to meet somebody on the morning of surgery when they're naked in a gown, nervous before we go
yeah,
back to the operating room. I want a good physical exam. I want to review the plan and make sure we're all on the same page when everybody is kind of comfortable. And so, and
right.
I don't let anybody make changes on the morning of surgery.
No.
That the emotions are high, everybody's anxious. Like that's not a time to do that. Ideally, we have our plan set in stone at minimum 2 weeks before surgery, and then we're just revisiting that with a good physical exam the day before surgery.
100% agree with that. Okay, so now let's talk about the cost,
Okay.
because you know, plastic surgeons that I've interviewed are on the very, very high end. And I've oftentimes tried to explain this to people. It is you know, all of those diplomas on your back wall, and how many years you've been practicing this, and how many, you know, all of that technique, who you study, and all of that is super, super important. But also, you know, real estate makes a difference. A Beverly Hills plastic surgeon who is paying for a surgery center that is probably 10 times the price of somebody else's in Louisiana is going to be charging a lot more. So I've always told my clients, don't be afraid to travel. It makes it so much better that you've got your own recovery center.
Yes,
Um,
it helps. And so there's a lot of stress. And I think that's why a lot of people, and I don't know, I learned this. I traveled for my breast surgery and it was really stressful. I was staying in a hotel room and I didn't know the part of town. It was just like one of those things where I learned a lot just by being a
yeah.
patient. And so on the other side of it, when I had the opportunity to open my own practice and move forward with this, and when it started being all of my patients were coming in from out of town and we were sending lists of VRBOs, and it was not all of them had recliners. And then my husband and I in the evenings were delivering recliners to houses because I wanted to make sure people were sleeping elevated. I was like, let me just make this easier for everybody. And that's why we have a recovery house. They show up, all their meals for the week are already in the refrigerator. It's like, and it's 2 seconds. It's literally, you could walk to it. It's a quarter mile from my office, which is where the surgery center is. So really making it the least amount of stressful possible so that those cortisol levels are low and you're just cruising, and healing is huge.
You guys, when you are wrapped up like a mummy, your face, it's your face, okay?
Mhm.
You can hide your boobs, you can hide a tummy, you can hide a lot of things, but it is very difficult to hide your face. And so there is a stress level when it comes to having surgery on your face that is like no other body part. Because how do you explain that? How do you,
Mhm.
you know, bad work is going to show up on your face. So that said,
Do you want me to finish the
what
pricing chit
is your
chat?
cost? Yeah. So
So,
I was going to say, this is
yeah,
not the time to bargain
yeah.
shop, or, you know.
Absolutely. And so I do agree. I do think real estate in general plays a part into the pricing, because I know that compared to Beverly Hills in New York, my pricing is inexpensive. Locally, I am very expensive. And so it's something where it just kind of depends on your real estate. And so in the scheme of things, you shouldn't base, in my opinion, your decision based off price. Like a lot of times you go into my DMs and it's like, what's your price? What's your price? What's your price? Not what are before and afters? What's your aftercare? Are you the one performing all of the surgeries? How often do you see me post-op? Like I see every single patient post-op myself every single day for the first 2 weeks. You get my personal cell phone number. Like those are the type of questions that you should be asking, not necessarily
And
just
for
price.
those of you guys out there, I do not know the answer to this. I have not asked. All I've done is started stalking your Instagram,
So
which is Pennington Facial Plastics. And the reason is because your work is so freaking good. And then the more that I would hear you talk about what to do before, what not to do, when I heard you talking about threads, when I found out you had your recovery center, I'm like, this is somebody that I need to have on the show. And I don't know what your price is.
And
So
and it
we're
varies.
gonna
So,
learn.
and that's the thing that, so like in general, geographically, locally, there's people that are $15,000. And then, you know, I'm in the range of anywhere from $30,000 to $80,000, depending on if you've had surgery before and what we're doing. And that's something like if we're just doing a brow lift, if we're just doing upper lids, if we're doing a brow lift, upper lids, lower lids, mid facelift, lower facelift, neck lift, deep neck lift with glands, lip lift, fat grafting, harvesting, laser,
Which
and you've had this
which
before.
you do at the same time.
Absolutely. We can do full facial rejuvenation in one day, no problem. And I do that on patients. I do it on patients who previously had facelifts by other surgeons, and it's revision surgery, which traditionally can take a little longer or you have to be a little more careful. So it's something where pricing really varies, and it based on patient's anatomy too, because if we're just doing a little tweak versus a full overhaul, there's a difference. And it's more about the investment of time on my end. And all of that includes all of the post-op visits, it includes the hyperbaric, you know, there's a lot of things that go into it. So what I like to do, and the way my process is set up, is you submit pictures and then my patient care coordinator calls and it's like, essentially, what are you interested in? And we like to give our patients like a price range of, in general, we try to give a price range that's within $10,000 to $15,000 of where it's going to be over the phone before you decide if you're going to book a consultation with me, after you've heard about kind of, you know, everything that my office has to offer. And then if you're like, okay, I want more information, I want to set up a consult, then we set up a consult and talk. And if you don't book with me, that's totally fine. But you at least have a general range of where the pricing is going to be for you and your kind of particular goals and the procedures you're planning to have before you call, because price does matter. It's not, you know, if everybody could do whatever they wanted, that'd be a completely different thing. And I know that price is a thing for some patients. I just don't think it should be the primary thing. I think they should kind of pick out what their main goals are, what they're looking for in a surgeon first. And then once they have that information, then include pricing with it and talk to a lot of people and get a lot of information.
Yeah, I went to like 4 different, before I had my neck done. And it was a neck and a lower, because at that time you couldn't do a neck without doing a lower because there was no place to put the skin. So I had a neck and a lower done. And at that time I had went to 4 different doctors throughout the LA area before I decided on Dr. Mark Monty. And I love my work. I think what he did was great. I still trust him. He's very freaking expensive, but he's in the heart of Beverly Hills. He does all of the, you know, stars, all of the, you know, movie stars that claim that they don't have anything done. I got the inside scoop, you guys, which we're going to go into the stigma about plastic surgery, because I know for a fact, because of what I do and because of the relationships that I have with surgeons and because of the interviews and because of various things, I know for a fact that there are people that will forever go down to their grave, famous people, of never having a facelift, never having a neck lift, never having anything done, and yet they have, and they make a ton of money selling creams or being the spokesperson for Juvederm, when they've had a full-on facelift. So let's get to the stigma behind it. And I want to start with something. When we jumped on our little thing earlier, I had my hair down and I put my hair in a ponytail for a reason, because I saw this thing from Selma Hayek, who I love. And she did not deny having work done, but she was on some talk show and she said, the host said, something, asked her what work she's had done, and she said, no Botox. Like, I will not try the accent, okay?
Yeah.
but you guys know who Selma Hayek is. No Botox, no filler. And you hear the host go, Selma, and starts chuckling. And she said, you see this ponytail? It's very tight. I wear it very tight. It's uncomfortable for me, but I bear with it for you. And that's all she wanted to say about stuff that she's had done. And it's a very personal thing. But what is the stigma behind it? Like, let's talk about why are so people why are people, and I find it to be mostly men, shaming women for wanting to have to look as good on the outside as they feel on the inside?
I think that stigma is changing. I think younger generations are a lot more transparent about it. I find in my practice when I have patients that I say, gosh, like maybe 1 in 30, 1 in 40 patients actually let me share their before and after pictures. And so that's one of the challenges in my practice. I have more that will let me share like in office privately, and patients are like, oh, can you email me? And I'm like, I actually can't, because this patient trusted me and I can show you in office.
Yeah.
So I always respect a patient's privacy, and it's kind of a very personal decision, but I do find that the stigma is changing. And
Yeah.
I think my younger patients are much more transparent and open about it, because I think it's just one of those things that now with social media and now with education, people just understand that it's kind of like going to the gym. It's just part of life. And so it's one of those things that if you're going to stay relevant and we're living longer and we're healthier, that this is just part of it. And I think
It's
when I look back
part
at
of it
like
for
my
some people, because some people are like, I never want to have anything done, and I'm just, why just age gracefully, age naturally, age gracefully. And I look at that and I'm like, I think I'm aging as gracefully as like a New York ballerina who got this,
right. And
you know.
so like the definition of age gracefully is different for everybody. Like you can age gracefully with a facelift. Like what about that is not graceful? You're still going to look really good. So I think it's something that if your work is natural and subtle and understated and refreshed, like that for me personally is my goal. I'm not
Yeah.
into like the fox eyed, big puffy, any of those things. It's that effortless beauty that I think most of my patients are aiming for, that I personally aim for. But to be effortless takes work. And that's something that like for you to be as fit as you are and your skin to look as good as it does, that takes maintenance, that takes eating healthy, that takes sleeping right, that takes skincare, that takes microneedling, that takes going to the gym. And there's nothing wrong with taking care of yourself. And that's something where I think younger generations are a lot more aware of that. And people are drinking less alcohol, and people aren't smoking cigarettes, and people value sleep and they value self-care. And
Yeah.
so I think 5 years from now, this is not going to be a conversation that we have to have. I think it's kind of the older generations
Yeah.
um,
I hope not.
where it's the
I hope
thing.
not. I had just got called out by somebody from, I guess, Gooped or whatever, that thought that I had not posted my entire surgery on YouTube, which I hired my film guy to come in and
Mhm.
film my entire neck lift, which is on YouTube. It's still there. And so I try to do my part to break that stigma, right? Because when people see me and they're like, you're 56 years old, and they write down in a comment someplace, she didn't tell you about the facelift. And I'm like, not only did I tell you, but I published it myself and paid to have
Yeah.
it published. But
Yeah.
it's also, like you said, it's exercise, it's sleep, it's what are you eating, it's stress reduction, right? It's antioxidants, it's superfoods, it's a lot. And yet we don't get shamed if we want to work out 5 days a week.
It depends
But
on who
if
you
we
talk
want,
to.
that's true.
It
That's
depends on who you talk to. Yeah. So it's really one of those things that and I find with women, and particularly like I am I'm a working mom, I'm self-employed, like I get how easy it is to put everybody else above yourself. And I find that a lot of women just have personal guilt. They're like, oh, well, I have a child who's going to college. I don't know if I should spend this money on myself. And there's things with that of like, it is okay to want something for yourself. It's okay to do something for yourself. And I think there's guilt there that we as women just put on ourselves, particularly
yeah,
mothers, I find. And I get it. Like I've been there, I am there. And if I want to take an afternoon and just like not talk to a soul and lock myself in the bedroom and read a book and drink some coffee, like I have guilt that goes with that, and I shouldn't. And so that's something where we just have to retrain our brains as women to be able to kind of like put ourselves in the space that we need to be, because you can't pour from an empty cup. And if this
yeah.
is something that is going to kind of refill and rejuvenate and make somebody feel better and be more confident and post their family pictures and take that vacation or do that second marriage or do that part of life that's going to make them feel good, is if it's being done with good intention and not at the behest of someone else, but for themselves and themselves only, there's no reason not to.
Absolutely. I love that. Oftentimes I will, I'm like the queen of self-care, and I multitask everything. So like you know, I did a whole show on Instagram Live where in 1 hour, it was called Get Ready With Me. And in 1 hour, I got like the light on the eyes. I delayed my caffeine. I took a cold plunge. I did 20 minutes of red light therapy. You know, I gave myself a shot of BPC 157 because I was healing a shoulder. Like I did all this stuff in an hour, still got my gym clothes and out the door. And I think it's that prioritizing of self-care that I think for women and mothers in particular is so difficult for us to do.
Absolutely.
But you're worth it, everybody. We're all worth it. Okay. There was a couple of questions that I think, you know, I got questions sent to me because I think people are embarrassed to ask here. I got the questions sent to me like, how soon can you have sex after a facelift?
So, I mean, I get this question a lot. So some of it depends on what kind of sex, like how much participation you're going to be doing. And so I usually tell my patients 2 to 4 weeks on that one, because I clear patients for like rigorous cardio, like Peloton running, those kind of things at 4 weeks. And then I usually clear patients for weightlifting between 6 to 8 weeks, depending on what surgery we did.
Because that's straining. That's like more straining.
Correct. And I Botox all of my patients platysmoplasty, like where I did their surgical repair at their 2-week post-op. So I want that Botox to be like kicked in, doing its thing by their 4-week appointment. And that's when they can start doing things of turning their head and flexing and straining. So they're not fighting against that surgical repair.
And for those of you who missed that live show that I did where I did a Botox, I called it a Botox necklace. Yeah. Nothing's going to replace surgery, but there are strategic ways that you can put Botox in, especially in the bands going down, that help to kind of lift that up and smooth out that whole area. So there is a live show on that. For those of you who aren't used to my channel, in my story highlights under live shows, you can go back and watch some of those different things. Okay, the next question I got that I know that somebody didn't want to ask on here, but so they sent it to me, was how soon afterwards can you smoke pot? And how does marijuana use relate to healing?
So THC itself can actually decrease the speed at which you heal. So I like all of my patients to ideally be off of it 6 weeks before surgery and wait for 6 weeks after surgery. It's not one that I test for. The only thing that I test for that I like really, really care about is nicotine, and nicotine is a no-go for surgery. THC is a soft call. But it is something that there are clinical trials that do show that it can delay wound healing. And so if you are going to be exposed to THC in the perioperative period, my preference is for it to be like orally, like an edible versus smoking. But in the patient, I have a few patients who are doing it for like anxiety or chronic medical conditions. And so that's one where ideally 2 weeks before and 2 weeks after, but my first choice is 6 weeks before and 6 weeks after.
Amazing. Okay, then, and I know you're doing hyperbaric, and I actually did a couple of, and I love that you include all of that in your pricing, because to me, that is a surgeon that isn't just like a cookie cutter McDonald's. You've gone through the drive-through. Okay, go away now. You understand that the healing process leads to better results. Better healing quicker healing leads to better results. And so you're getting them in a hyperbaric chamber immediately afterwards, or the next day, or how soon?
So the day after surgery, starting on post-op day 1, if they have previously had a facelift, or if they have history of smoking or anything where they might have delayed wound healing, we'll actually have them do a dive the day before surgery. But traditionally, it's just day 1 after surgery. Usually we offer to them every day for the first 2 weeks after surgery. We usually give them a break on Sundays, but that's one of those things that if I'm worried about anything, if there's any reason, or if they just feel very strongly about it, we just have them do a dive. They're anywhere from 60 to 90 minutes. I have 2 different chambers. I have a soft one and I have a hard chamber. Most of my patients prefer the hard chamber, and that one goes up to a little bit higher pressure, so you get more oxygen. It's just a bigger bang for the buck.
Hard chamber. For some reason, the soft chambers scare me. I don't know why.
It's interesting because I have one particular patient who has a little bit of just claustrophobia, and she prefers the soft chamber, even though I feel that the hard chamber is room roomier and has a big kind of glass window on it and stuff. It's something about it being soft makes her feel better. So that's why we have both. It's kind of patient dependent on that.
For
But it
those of
makes
you who
a big
have
difference.
not seen a hyperbaric chamber, you can go to my YouTube
Oh, I was
channel.
gonna say,
Again,
I can walk you guys over there.
oh,
But
oh yeah, if you can.
let's see.
I mean,
So
yeah,
we can,
let's do it, because we're and I want to see if you have any before and afters that you can show us. Otherwise, I'm sending everybody to your site to go. You guys go to Dr. Pennington's Instagram. It's Pennington Facial Plastics. Okay, go ahead. Sorry.
Oh, it's okay. I'm just walking over it's right across from where my office is. And so we have, I'm going to try to show you my hard chamber one here.
Yeah.
And then we have the little soft chamber one here.
See, that one freaks me out.
Yeah. So this one's nice. It's got like a big glass window that goes on it. And it's got a phone in it that like you can call and we can communicate with the patients while they're in there.
I love that. And can you just quickly do a little, just a tiny science dive into how that helps speed up healing?
So essentially what it does is it provides more oxygen to the tissues. And so when you're healing from a surgery, what causes kind of some of the delayed healing is just lack of oxygen because the blood can't get to where it needs to go, which is why swelling makes such a big difference, because the more swollen you are, the more compression there is, the less that blood can get to the distal ends. It also helps with the just general overall inflammation and then some of the free radicals that happen. So it's been studied and it's been on the market available for like chronic diabetic wounds, those kind of things for years. It's more just the chambers are so expensive that people weren't buying them. And for me, it has such an added benefit for my patients that I was like, I'm happy to invest in this if it makes it better.
What is your thought on red light therapy? Now, I would never use this mask after a facelift because you wouldn't want that against your thing. But I have the big panels up in my room that I use every single day. What is your thought on when you should be doing red light therapy post-op?
So I like to avoid it for the first 2 weeks after surgery. There are surgeons, there's one in England, in London particularly, that does it post-op day one because he says, well, if the patients are going to bleed, then you'll see it because it does increase blood flow.
It does increase blood flow.
I personally have my patients wait and start that up to 2 weeks after. And that's something that's going to help kind of with cell turnover if there's any persistent bruising or things like that. But it's something where I don't like it for the first 2 weeks because I know that there's good blood supply. I don't want extra blood supply.
Yeah. Now, folks, when we're talking about stuff like microneedling or we're doing stuff where we're only millimeters deep, then red light therapy right away. That's something that that's in my protocol for my microneedling, like how I heal quickly with that. But when we're talking about deep plane lifts and we're like in there, in that tissue that's deep, that you don't necessarily want extra blood flow for a little while.
Correct.
It does help with the scarring and all of that kind of stuff.
It does. I have a very specific microneedling protocol that I do on my post facelift scars. It's about to be published. We're doing a clinical trial with it at my office right now. And so if you're local, it's something that I offer. It's for free. And for my patients to travel in, we give you all the serums that we use for it and the protocol, and we send it with you, and you can have somebody local for you do that. And we start the microneedling as early as 2 weeks post-op on the scars, and it makes a huge difference.
Huge difference. I've been doing microneedling for a long time, and I do it a lot on camera. I have a whole protocol there. I give different needle links for different body parts, like anything that's crepey that I feel like needs some collagen, some elastin. I microneedle the heck out of that thing. And I red light therapy after it as well. So it's nice to hear that for the surgical scars, because I get that question a lot with microneedling in terms of stretch marks and scars. It's absolutely wonderful. And it works.
I agree.
Okay, is there anything else you want to show? Can you show us any photos of any before and afters of like?
Absolutely. So, you touched on two different things. And so one is doing kind of being more progressive and certain like you did, like where you're doing it at a younger age. And this is a perfect example of a patient who very similar age to you when you did your surgery, where it's not terrible. She's not somebody that you would look at before and be like, oh my God, you're so old. This looks so bad. You need to have surgery. But she looks just really refreshed and youthful afterwards.
Yeah.
Versus a patient who This was something where it's a much more profound difference when you look at the skin quality, the skin laxity versus having kind of a nice defined jawline. We did laser with her at the time of surgery, and it can make a very, very big
that
difference.
looks like at least a 20-year difference right there.
Exactly. And some patients, it's okay. It doesn't matter where your starting point is, we can help. But I do find that my patients that are a little bit, and this is a patient in her 60s who just took really good care of her skin, but just had, laxity. And this is something where you can see that laxity is gone.
Yeah.
And she looks refreshed and youthful, but still like herself. And it's not great. It doesn't have to be profound to be a really beautiful result. And so there's a lot hold on, that's this smaller. Let me look at this one. There's a lot where you look at a beautiful younger patient and it's just softer, more feminine, more youthful, more refreshed.
Yeah.
And they still look like themselves. If you're looking at before and after pictures and people are looking crazy and they're not looking like themselves, that should be a red flag. That should be, hey, let me get another consultation.
The jaw line that you do, that jaw line that you bring back with what you're doing with the neck, I think is, I haven't found anybody that's doing it any better than you are.
I'm very, very, it's probably hundreds of miles for me where there are people that are doing the neck stuff that I'm doing. I find that the neck is one of the places that shows your age the fastest. And so a lot of patients, and this is a really good example, where you could have easily, in this patient, just kind of addressed and pulled, her SNAS back. But this fullness that she has here is her salivary gland, her submandibular gland. And so I'm doing things where I'm trimming muscles, trimming glands, like really aggressive.
That's what I did on mine because I didn't have a lot of laxity because I was microneedling, because I was doing all that stuff. But I did have, if I can get my before, you can see I had right here, this laxity right there. And I had a muscle that he actually had to trim the muscle back because that was a genetic thing that I had. But the difference that you can make in that, I haven't heard of the salivary gland, but trimming that muscle, that's why I thought he was way ahead of his time with that. But there's not a lot of people that are doing that.
There's not. I've personally given lectures. I'm gonna fix this. I've personally given lectures in Paris, in New Orleans at the Academy meetings. Like I've been lecturing about this for a couple of years, and it can make a very, very big difference. It really refines the results. It can take a good result and make it great. And there's a lot of things that genetically somebody's like, aging has made it worse, but I've never had a jawline that I liked. Like that to me is like a ding, ding, ding. We should be having another conversation.
Yeah.
And that's where having a surgeon that's really comfortable with the anatomy. And this is one where you can kind of see, this is probably the digastric muscle. That's probably the muscle that he trimmed on you.
Yeah.
And this is where that gland can sit really low and be big. And so addressing and being comfortable with the anatomy and addressing whatever's needed by the patient is something that I kind of really pride myself on. And again, the neck is an area where it can show your age the first. So being able to be most aggressive there in a way that still looks very natural is huge.
Agreed. This has been, so much amazing information. I'm a huge fan. I'm going to continue to be a huge fan. For those of you who have not seen Dr. Pennington's Instagram, go to Pennington Facial Plastics. I'm going to invite you on as a collaborator. But before we get off of here, because we're about to get off, I want to just tell everybody about the giveaway real quick because your followers are going to be able to be right in there with mine. So this is what is up for grabs. It is worth $269. This is the Magellan Red Light Therapy Mask and Neck and Chest Decolletage attachment, which I love. And so what you'll need to do is comment red light, not here, but when we post it to the main feeds, and then follow Magellan Official and tag a friend who loves skincare. And I'm going to have all of those rules pinned in a comment up at the top so that everybody can join that. and I'll announce the winner next Saturday. I cannot thank you enough for all of this valuable information.
Thank you. And if anybody has questions, I manage my own social media. They can DM me. I'm happy to help.
I manage mine as well. There's very few people of us that are like actually like we're answering our own questions.
I'm on the ground level with you. I don't know. I don't think anybody can do it the way that I do it. So I think it's important.
I love it. I love it. I love everything about this conversation. Okay, everybody, have a great rest of your Saturday. Thank you once again for your time. It's been amazing.
Perfect.
Okay, bye everybody.
Bye.